When patients come in for smile consultation, we typically start by going over their medical and dental history to go over all of that, and then there are a series of questions that we ask them to try to find out what their needs and wants may be. Then we go into gathering information, which would be a visual exam, a clinical exam, and a radiographic exam, which might include x-rays or CAT scans. Intraoral exam is done in place of impressions, so we would have virtually the model of the patient with us here in the office. Fortunately, because of a lot of the advancements that we have in the office, we also have a facially simulated or facially generated software that allows us to take the information that we have gathered, just kind of overlay that to the patient's face, picture of the face or the profile, and would give us the ability to simulate how the patient would look like. That, to me, is a very, very critical point, because a lot of times patients think they want to change their smile or have some idea of how they want their smile to be, but they have never visualized how it's going to look with their lips in place and within their face and where their eyes at. By doing that, they're able to actually see what is possible and what can be done and how realistic it is. The color, the shade, the shape, the length, they all can be evaluated by just that one quick simulation. Once that's presented to the patient, we move on into taking some diagnostic records and proceeding with actually having a diagnostic plan, or I call it a blueprint. Pretty much like when you build a house, you need a blueprint to be able to build a house. So that is our blueprint to do the smile design. And from there, we design that and communicate with the lab what we're looking for, and that's where the process starts.